I'm Dean Watson. I'm an internist by training. I'm the Chief Integration Officer at Tallahassee Memorial and at Capital Health Plan. I've been here for 26 years as a practicing physician and as an administrator, and I was actively involved in developing the COVID management team, which started March of last year. Through these developments and through the actions of our staff and through our partnerships, we led one of the best response teams in the country, quite honestly. And all of the activities that you've seen with regards to vaccinations and participation have been a part of our COVID management team. We're very proud of what we've done. We are very proud of our understanding of the disease process, and we hope that you'll find this information very helpful. Because you think you're healthy doesn't mean that you are truly healthy. If you get infected, there are things that may happen 5, 10, 15, 20 years from now that we're unaware of, that are a result of this virus. These are all things that you need to take into consideration. Receiving a safe and effective vaccine to prevent these things, it's a simple way to help others, to help yourself. Speaking of helping others, if you're infected, you may actually infect your family, your colleagues, others that are at higher risk. So the best thing that we can do is actually take action, receive the vaccine, and minimize the effects of this virus across the city, across the county, across the nation. What we know is that natural immunity, meaning immunity after infection, is beneficial for months, not sure how many months, but for months after the infection. Remember that it's beneficial for that virus that you were exposed to. Variants are occurring, this virus is mutating. We know that the vaccines that are being produced, these very safe and effective vaccines, work against these variants. So if you have natural immunity, yes, you have time to think about it, you have time to become educated, but it's imperative. It's ultimately the most important thing you can do is to receive this vaccine to prevent further infection from variants that may cause severe life-threatening illness. Survival rates from this virus are really 98% to 99% in the US. The issue with that is that those that are impacted, that have actual issues post-infection, really fall higher into the 20% range, even higher. So you may think, well, I'm going to live, I'm going to survive this thing. I've got a 98%, 99% chance of survival. The main issue is that what are you going to feel like 5, 10, 15 years from now? What are you going to feel like 30, 60, 90 days from now? This virus is the real deal. When you get infected, it's going to impact your life. For those of you that are in that 80% range, remember, we cannot emphasize enough that just because you are not feeling the major symptoms, it doesn't mean that you're not spreading it to somebody else that is going to be impacted by this virus with severe, life-threatening illness symptoms. So it is utmost important that we all get vaccinated to reduce the likelihood of spreading this virus and to allow us to get back to a normal state of affairs in this country. Being infected by COVID is miserable. From patients that we've had in the hospital, patients that we've provided care for in our clinics, receiving the vaccination is not like being infected by COVID. Receiving the vaccine allows your body to create an immune response, which may cause you to have a fever or muscle aches or fatigue. Those are all good signs. They're not like having the virus itself. It's telling you that, you know what, we're developing the antibodies and we're here to protect you from here on out. So receiving or actually getting infected is going to be way worse than receiving the vaccine itself. There's absolutely no chance that any of the vaccines that have been approved for emergency use authorization will infect any recipient. None of these vaccines are active with regards to viral activity. There is a 0% chance. So how the mRNA vaccine works and the other vaccines work is they introduce, specifically the mRNA vaccine introduces messenger RNA that directs your cells to produce proteins that your body then reacts to. None of these viruses enter the nucleus. The nucleus of a cell is where all of your DNA is housed. So none of these vaccines interact with the nucleus, enter the nucleus, and therefore none of them impact DNA activity. So there is a 0% chance of any interaction with DNA or any effects on DNA within your body. Many people feel that it was rushed to market. In actuality, the mRNA vaccine that's being currently used by Moderna and Pfizer had been studied for many, many years prior to the EUA, or the Emergency Use Authorization, that was granted recently. This vaccine was actually studied for viruses that were related to the coronavirus many, many, many years ago. And so I'm comfortable with this, and actually very, very happy that they have done all of the research and studies for the years leading up to these past few, which then led up to the EUA. So I'm very comfortable with the research, I'm very comfortable with the outcomes. This would not have moved through the United States processes without this being completely safe and effective. What people need to understand is this was not just 1 year of research. This was years and years. This goes back 5-10 years of early development, and we were lucky enough to have this development in place to allow us to bring this to market in such a short period of time.